How do you know if you might have asthma and need to seek medical treatment from a doctor? So first of all, if you recall in the What is Asthma video, I told you exactly what asthma is, right? In this video, we're going to talk about signs and symptoms of asthma, and you could tell your doctor and they can do some testing to figure out if you are an asthmatic. But sometimes people don't really know what they're supposed to look for. So if you've been experiencing any of these things for an extended period of time, please tell your doctor. Hi, I'm Dr. Renee. In these videos, you will learn all sorts of tips, tricks, and strategies how to help you to live the life you deserve. Because let's face it, this is not a dress rehearsal. We've only got one life, so we might as well do it right. I would love for you to join me on this journey. So why don't you hit the subscribe button and hit the bell, so every time I upload a video, you'll receive a notification. But of course, all the information I'm giving you is great information for you to take to your doctor. So please make certain that you are visiting a healthcare professional regularly. The information you hear me talk about, process it and talk to your doctor and find out how it can best help you. These are the symptoms. Let's just get right into it, right? Persistent coughing. So that means you cough all the time, and sometimes in the night, sometimes early in the morning, but really anytime you cough. So coughing is a major feature of asthma, especially in children. Sometimes it can be the only sign of asthma. So if you have a cough, please go check it out. Wheezing. I call it my inner whistle because that's what it sounds like to me. But wheezing is when you have difficulty breathing and it's got a whistling sound to it. So that's why I call it my inner whistle. That whistling sound is coming from your airways. So if you wheeze, please make sure you go and get that checked out. Shortness of breath. Now, thank you, Jesus. I've never had a heart attack. My shortness of breath have always had to do with asthma. So if you feel like you just can't get enough air, one of my big things that I usually do is I'll inhale. And if I can't inhale deeply, I know I'm about to be in trouble with an asthma attack. So if you can't inhale deeply, that's usually a good sign that you're having some shortness of breath. And this shortness of breath may even find it difficult for you to sleep, eat, or even speak. So please go get it checked out. Chest tightness. Now, like I said, I've never had a heart attack, thank you, Jesus. So I don't know what that feels like, but I do know asthma chest tightness. It literally feels like someone is squeezing your entire chest cavity. And also when you breathe, it hurts so badly. You have muscles in your back that are starting to work to help you breathe, and your back starts to hurt as well. So that's the chest tightness. And this unpleasant sensation of heaviness or pressure in the chest. It can make it so hard to breathe. Like I said, you have to use all these extra muscles. You start getting sore back. There is a vessel that usually pops out in my neck when I'm having an asthma attack, because those are some more muscles that I'm trying to use around my neck to breathe. Increased mucus production. There are some people, when they laugh, talk, you can hear mucus moving. That is not a good thing. But I also must tell you, there's a lot of things that people consume that cause increased mucus production. Number one being dairy, and I'm talking about milk from cows. So I am now dairy free. I drink oat milk. It has tremendously cleared up the mucus production in my body. I used to all the time. I don't anymore because there is nothing there. Difficulty breathing while exercising. So just because you're exercising does not mean you should have difficulty breathing. Now, difficulty breathing, exercising, I can understand you run and you, okay. But if it takes you like 20 to 30 minutes, and that's not funny because that has been me, 20 to 30 minutes to catch your breath after you stopped the activity, that's when you're gonna find yourself thinking something's not right. Also, if you can't even really get a good start with the activity because you can't breathe, you probably have a problem. And lastly, losing sleep. So oddly enough, asthma attacks tend to happen at night. Literally, I'll be awakened in my sleep and realize that I cannot breathe. So if you're losing sleep because you wake up because you can't breathe, please. All of these things can sometimes happen in certain situations. Like I said, exercise-induced asthma. Occupational asthma is when your trigger is at your job, but it's not at your house. So every day you go to work, and every day at work, you start having shortness of breath, you start wheezing, but then you come home and you're fine. Allergy-induced asthma, very similar. Any of your triggers are airborne, come in contact with you, and you get sick. So these are some of the situations where you could find these signs and symptoms. My biggest thing is, please, if you're experiencing any of these signs or symptoms, please tell your doctor. If you have shortness of breath and you really cannot catch your breath, call 911. People have died from asthma attacks. I will repeat. People have died from asthma attacks. There's a couple things probably you should not play with in your health. You really shouldn't play with your health at all. But if you cannot breathe, you have to be able to breathe. You don't want your brain to go without oxygen. So please, 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 if you can't breathe, make sure you do immediately seek emergency attention. But otherwise, if you have any of these symptoms, let your doctor know. Now your doctor can help you and figure out what's going on. But then if you do find out you do have asthma, my biggest piece of advice, to get yourself two things: pulmonologist or an allergy immunologist. Those are the two kind of doctors that are the best equipped to treat asthma. I think internal medicine doctors are amazing. Pediatricians are amazing, but these two specialties in particular know everything there is to know about asthma, all of the new and more innovative ways to treat it, the new medications, etc. So those are the two specialists you want to look for, a pulmonologist or an allergy immunologist. So if you have a child that's been diagnosed with allergies and you're not seeing an allergy immunologist, tell them Dr. Renee told you you should go see one, okay? Do you get short of breath when you exercise? Or do you wake up in the middle of the night and can't breathe? Please, let's talk about it in the comments below. I'd love to hear your story. Thanks for watching, and I hope you learned something from this video. Don't forget to subscribe, hit the bell for the notifications, and of course, if you want to learn more about me, you can click this video here. And if you would love to see a video that YouTube suggests that you watch of mine, click down here. Thanks.